Nagbabalik mga kasambahay ang Doctors on TV. Mga kasambahay, ang topic natin this morning, hazard-free summer. Panoorin natin ang video na ito.
Ilan sa mga karamdamang karaniwan tuwing summer season ay ang mga sakit sa balat, mga itinuturing na childhood diseases tulad ng tigdas, chickenpox o blutong, seasonal flu at iba pa. Mataas din ang kaso ng mga heat emergencies kapag ganitong panahon. Halimbawa nito ay ang matinding sakit ng ulo, dehydration, heat stroke at marami pang iba. Ang heat stroke ay maaaring mauwi sa kamatayan kung hindi maaagapan, kaya't mahalaga ang awareness. Kaya naman muling nagpapaalala ang Department of Health sa publiko na magsagawa ng karagdagang pag-iingat ngayong panahon ng tag-init. Dahil sa panahong ito ay tumataas ang kaso ng mga karamdaman at health condition na may kaugnayan sa mainit na panahon. Ngayong umaga, ating pag-aralan ang mga summer health conditions upang maiwasan ang mga posibleng malalang epekto nito sa kalusugan. Kasama ng mga expert, Doctors on TV.
At yan po mga kasambahay, ang topic natin for this morning, a hazard-free summer. Of course, to help us, we've invited a very special dermatologist. She completed her training, her masteral course in St. John's Institute of Dermatology in London, proceeded to the National Skin Care Center in Singapore for additional further training. Currently practicing at the Luminous Clinic in Fort Bonifacio, Global City. Please welcome Dr. Kaycee Reyes.
Thank you so much.
Good morning, Dr.
Good morning.
Thank you for joining us this morning.
It's a
Special
very,
summer
very
episode
hot
talaga.
summer. No, it's a very hot summer, Doktora. Yung mga tao, they wanted to plunge in the pool. Yeah.
Dr. Our topic for this morning is hazard-free summer. What can we do to prevent skin diseases or treat skin diseases early? Ano ba yung mga common na skin diseases, Doktora?
Number one, we should protect ourselves from the sun.
Okay.
Kasi according to studies, like 98% of people, they don't, hindi sila nag-a-apply ng sunscreen effectively. Kasi sa studies, they put more sunscreen eh. Pag sa tayo, matakloban na lahat ng face, pwede na.
Okay.
So, the recommended sunscreen amount for the whole body is 1 shot glass. 1 shot glass, 1 ounce.
Around 60 ml.
Yes. Oh, galing ah.
So, nice shot.
Apo. Yun po, okay yun. And then, ang pinaka-importante is we apply every 4 hours. Since ang half-life ng sunblock is 2 hours. So, after 4 hours, it's gone na.
Okay.
So, we should look for a water-resistant sunblock. Usually, water-resistant sunblock around 40 to 80 minutes. There's no such thing as waterproof. So, it's just a marketing strategy. So, we should really reapply. So, hindi ibig sabihin na SPF 70 or SPF 100 that it will take longer because the half-life is just 2 hours.
So you really have to apply often, Dr.
Opo.
The water-resistant sunblock applied every 4 hours
Yes, Doc.
as long as you have exposure to the sun.
And the whole exposure should be 60 ml.
60
One
ml.
glass. Alam niyo ba, Doktora, kapag mag-apply? Kasi yung iba kasi, swimming ako ngayon, tapos saka pa lang sila maglagay. Is there a time lag bago mag-e-effect yung SPF property?
Doc, 15 minutes.
15 minutes. So, kailangan 15
Yes.
minutes muna. So, wait lang muna ng
Absorb.
screen.
Kasi baka ma-wash off lang pag
Yes.
nag-swimming agad.
Ito naman, no? Medyo takot tayo sa init ng araw, no? Sa sunburn. Doktora, apart from sunburn, ano ba yung mga diseases na makukuha natin
Yes.
sa tubig kapag summer?
Yeah. Pag sa water po, very common. Even sa beach, sa pools, we get skin problems. And here in the Philippines, the most common is infection. Kasi our body, we have normal commensal organisms living on our body. So, normal bacteria, normal fungus, normal yeast, they live on our body. Example nito is like Propionum acnes, which causes acne. Talagang nakatira siya sa skin natin. And then, Malassezia, which is a yeast species, it stays on our skin. But, yes, opo. Pero during summer, nagiging mas moist yung active. And they thrive on this moist areas of our body, yung mainit. So, ang nagkakaroon ng imbalance sa bacteria at saka sa fungal population ng body natin. So, ang nangyayari, nagkakaroon ng infection. Doon na nagkakaroon ng, like for example, for fungal infection, some people, usually athletes, they get fungal infection or athlete foot. Kasi minsan like sa gym, they walk barefoot and they use other people's parang towels. So minsan hininiwasan kasi
Mga locker
nagmamadali.
area siguro, doon nakakuha yung mga fungal
Opo.
infection.
And then, yung isa, so with that, yun naman, meron naman bacterial infection din kasi during summer, we sweat a lot. And sometimes, yung nakaklog yung mga sweat sa sweat ducts, it can cause heat rash or milia. And then minsan, pag sobra siyang inflamed, ang nangyayari, nai-infection ng bacteria. So this can cause folliculitis. Yes.
Yung infection na.
Folliculitis na po.
And how do you avoid these, Doctora? Keeping your skin dry?
Yan.
You cannot keep your skin dry
Ang
when you're
hirap po, no? Ang hirap talaga. But,
Summer na summer.
kasi pinaka-okay po, if you can, since hindi talaga tayo makakaligo agad, if you can have clean wipes with you right after going to the gym, and if you can take a bath,
Okay.
excuse me, kung hindi po kaya, you can use clean wipes right after. You wipe the areas where there's lots of sweat ducts, sweat glands, like on your axilla, yung breast area, yung groin area.
Ayun.
Yes.
Eh, what about naman sa pool? Pawis na pawis ka. Sometimes kasi nagsiswimming ka, pinapawisan ka rin, di ba, Doktora? So, paano yun? Can we readily acquire infections kahit na may chlorine ang water?
Yes, pag hindi po properly chlorinated yung pool, minsan we can get other type of pathologic bacteria like Pseudomonas, which is really harmful for the skin because it's not a normal inhabitants of our skin. So, mas delikado siya. So, we really have to like in Ace Water Spa, I'm sure they're taking good care of their pools.
Of course.
So, it's well chlorinated. So, I think it's good to swim here. Kasi if you have pool at home, you should have someone to maintain the pool.
To choose the facilities you go
Yes,
to
yes.
very carefully.
Yes.
Make sure na they practice yung mga hygiene talaga, na
Yeah.
malinis, para hindi ka
Ako, suki ako dito.
Oo nga eh.
Oo. Ano kasi yan eh, depende yan eh. Minsan, sa maling facilities, masyadong sumosobra yung chlorine din. Doktora, does it harm your skin?
Yes.
Kapag sobrang chlorine.
Yeah. With
Meron ka bang,
chlorine.
excuse Doktora ha?
Yes.
Pag nag-plunge ka sa pool, may mararamdaman ka ba sa skin mo kung over? May mapipil ka ba sa skin mo pag nag-over-chlorinate sila?
Kasi minsan pag over-chlorinated, ang nangyayari, you lose the skin barrier function. So, if you lose the skin barrier function, lalo na if you stay in the pool for a long time, your skin cells, it will shrink. Pag nag-shrink siya, mas madaling pumasok yung mga, mas madaling mag-evaporate yung moisture in between cells. Pag nag-evaporate siya, yung skin barrier function mawawala, and then the harsh products, harsh chemicals, it can easily penetrate your skin. Then it can cause dryness, at the same time infection.
Ano ba first aid for sunburn?
For
For mga
sunburn,
mild sunburns lang siguro or moderate sunburns?
for mild sunburn, wala na po tayong magagawa pag sunburn. You put cold compress,
Just cold compress for
or
comfort.
if you have aloe vera gel, or
Okay.
yung moisturizer that you can put in the refrigerator.
Alright.
And then you can ask your doctor if you can get mild anti-inflammatory creams like cortisone creams, hydrocortisone. It's a very mild steroid that you can apply for not more than 7 days. And
Alright.
then you should drink lots of water, and then you can drink mefenamic acid for the pain.
Okay, so yun ang basic na ano.
Ayan. Well, thank you, Doktora. Ang dami namin natututunan. Pero bago pa tayo magpatuloy ngayon, dito sa napaka-importanting topic, no, na marami pa tayong pwedeng maging infection pala ngayong summer. Pero bago natin pagpatuloy yan, panoorin muna natin itong health update.